welcome to the latest installment of Clinician's Brief, the podcast, the conversations behind the content. I'm your host, Dr. Alyssa Watson, and I'm very excited for today's discussion with professor and rehab veterinarian, Dr. Nina Kieves. Dr. Kieves is currently at The Ohio State University, where she's an associate professor of small animal orthopedic surgery and the director of the Sports Medicine and Rehabilitation Service. She recently co-authored an article which appeared in the July 2022 edition of Clinician's Brief that detailed the diagnosis and management of osteoarthritis pain in a cat. Hi, Dr. Kieves. Thank you for joining us today.
Hi there. My pleasure to be with you.
Before we talk a little bit about your case, I would love it if you could introduce yourself to the audience. Give us a little bit about your background. I understand you did your residency at my alma mater, Iowa State University. So I'd love to hear how you ended up where you are now.
Yeah, sure did. So I did my DVM at University of Minnesota and stayed on there for my rotating internship, and then was lucky enough to stick in the Midwest for my residency at Iowa State. So go Cyclones. And then I did a fellowship out at Colorado State for sports medicine and rehab, and then ended up at Ohio State, where I have been since 2015. So currently work both in the orthopedic department as well as oversee the sports medicine and rehab department there.
That's great. I am so excited about this topic because, we've had several discussions on the podcast about analgesia in cats. However, oftentimes those conversations have really centered around surgical pain, not chronic pain. So I think I, for one, can really do a better job of managing this type of pain in my feline patients. But it can be harder to recognize osteoarthritis pain in cats. They're not always super cooperative for examination. And I feel like, oftentimes owners don't realize that cats are suffering from osteoarthritis pain either. So what are some common clinical signs, that we may be able to glean that owners might notice at home?
Yeah, that's a great question. And I think you hit the nail on the head there. We often don't recognize it in our feline patients, unlike our canine patients where they're going out for a walk with their owner multiple times a day. And so people will notice that they're lame or slowing down. But cats, number one, are, more independent creatures at heart. And that's what I love about them. So they want you when they want you. And they're definitely better at hiding stuff from us as well. And so it may be something as simple as not wanting to groom as much if they're hind end, or wanting to jump as high as they used to. So I do love when clients come in and tell me, I finally taught them how not to jump on the counter. But probably it's that maybe they can't anymore, or it's uncomfortable. If they wanted to get up there and they could, let's be honest, they'd be up there. So it can be simple things like that, but it can also be something that may look like a completely unrelated medical issue. So they may be urinating or defecating inappropriately because now they're uncomfortable and can't get into the litter box, particularly some of those ones that, you enter from the top. And so it can be incredibly variable from actual lameness, if there is something more acute going on, to very subtle husbandry things that are changing for them. So it can be very different from our canine patients.
I can imagine that makes it a lot harder too to have kind of a standard history questionnaire because, as you said, everything can be so varied. Are there those specific questions that you make sure you ask every time? You had said about jumping up on the counter. That is one that I oftentimes ask. Do they still jump up on the bed? Do they still jump up? But kind of that, once I get past that question, those other activities, I sometimes falter a little bit to try to draw that information out from our clients.
Yeah, I think for cats, it can be helpful to certainly ask the jumping thing, but also, do they still enjoy being pet or brushed? If they have got discomfort, particularly in the hind end, cats tend to get hip arthritis and lumbosacral things. So if they used to love getting a good tail scratch and now they're shying away from that and don't want it, or they're noticing that they're a little bit unkempt and not grooming as much, those things can clue us in. Certainly, I think for feline patients, asking, urination and litter box habits is always important, but not just thinking about it in terms of the urinary tract itself, but also potentially considering that there might be OA related to why they're having issues with that. So I think those questions can help. And then, are they still playing as aggressively as they used to? Certainly age will slow anybody down, but it may be something that we can help with or intervene with in terms of making them feel better. So if they used to, chase the catnip mouse all the time and now they don't do it as much, then maybe that's a good reason to investigate further and see if there's something going on.
Once we get those cats into the clinic, this is another place where I stumble. Sometimes even getting them to move around the exam room is so hard. They come in, they're in their carrier, we have to pull them out of their carrier, and then the first thing they do is hide under the chair.
Yeah,
So
it's the pancake effect of the exam room. I think there's a couple things that we can do to help. One is, if possible, and this is certainly not something that can happen in every clinic, just depending on physical space, but we have a separate cat area, cat waiting room, doing those fear-friendly types of things that really help the cat feel more comfortable. We have feel away and things like that for our cat exam rooms. We try not to let dogs in there. And then we try to get the client and the owner in that room before the exam so the cat has some time to get used to it. So it's not just, hey, let me get you in this room and try to wrench you out of this crate and see how you're going to do. It gives them a little time to sit in there and wait and get more comfortable with the surroundings. Does that make every cat do a orthopedic gait exam? Sadly, no. But we try to let them get used to it and feel as comfortable as possible. Throw some treats out there if you think you aren't going to have to sedate them. Or if it's a cat that generally doesn't love coming in, if you can talk with the client and have them either give some of those medications ahead of time, like some gabapentin, not just in the car on the way over, but actually with enough time to make it worthwhile. So about 2 hours ahead of the exam, or video at home. So I ask a lot of clients to take videos of how the cat is doing and show what they're worried about, if anything, especially if it's a specific lameness issue that's bringing them into the clinic, because they are so different in their environment at home. And so if it really is a struggle to get them to feel comfortable in the hospital setting, then sometimes I'll say, today we're going to do our best, but we may need to have you send a video later just to really show us what's going on.
absolutely. There's so many things now that everyone has a smartphone, or almost everyone has a smartphone right there at their
Yep.
fingertips, a video recorder. That gives us a lot of information that we didn't have access to before. So it's really
Yeah.
nice to be able to have those things.
Absolutely. And if they're coming in too, we try to say, hey, do this ahead of time so we don't have to send
Mhm.
you away and come back. I mean, it's never going to hurt to have it. It's usually going to be helpful in some way. So,
You did mention gabapentin, for pre-visit anxiety and a little bit of sedation. Generally, you're okay with that. I know gabapentin can sometimes make cats a little bit ataxic, so I always worry about, how is this
mhm.
gonna affect our exam?
Yeah, if it's going to be something really subtle that we're working on, it can confound stuff. But in general, it's not going to change finding discomfort. It's not going to mask the pain that greatly. So if you are worried, though, that they are ataxic and it's more of a neuro issue, or you're trying to differentiate orthopedic from neurologic disease, then that may not be the best choice. But if that allows you to get your hands on the cat and comfortably do a full orthopedic exam, then I think that kind of outweighs having them maybe not be quite as perfect in their gait. And they do need to be on a really high dose for that to happen. So if you're using a reasonable dose, I think, unless they're super sensitive, in general, it's still going to give you what you need from them. You might have that one here or there that's super zonked out, and then you got to say, okay, like if we really need a gait exam, we got to rethink this. But you're going to find a lot out with your actual hands-on exam as well to rule things out, for example, if we're worried about the stifle, you know, I'm going to take more comfort having palpated that cat to know it doesn't have a luxating patella or cruciate injury than I am from walking and seeing it be a bit lame. So I think, you know, pros and cons to both for sure.
And then when we do need true sedation, for instance,
Mm-hmm.
a lot of these kitties end up needing radiographs. And I
Yeah.
know some people feel really strongly that in order to obtain diagnostic radiographs, these patients should be sedated. What's your opinion on that? And what medications are you usually using?
Yeah, I'm one of those people. We sedate every patient for radiographs. So I think that if you don't have well positioned radiographs, then you're going to have a hard time interpreting what you need to see. And so taking the time to sedate them is going to make it easier for your technicians who are taking the films and for the patient itself. So no one wants to stress a cat out trying to scruff it and put it on the table to get an x-ray that then is half crooked and you can't really tell what's going on anyway. So I say, unless there is a contraindication to sedation, you know, cardiac disease that's severe or something else, certainly getting comfortable with sedation, I think, is the way to go. In my practice, we're almost always reaching for butorphanol combined with dexmedetomidine so that we can reverse them. If the cat is extra painful, I might reach for a full mu narcotic, so something like methadone instead. But unless they have known cardiac disease where dexmedetomidine is contraindicated, that's going to be my go-to. And then if they're extra spicy, we'll add a little ketamine in.
Those spicy ones.
But it's a rare cat that we can't get sedated enough for films with a
Yep.
combination of a narcotic and a dexmedetomidine.
And a
Yeah,
little dexmedetomidine. Yep.
yeah.
In the article, you really make a point that feline osteoarthritis is a primary disease process rather than secondary to other
Mm,
diseases. Would you just
yeah.
expand on that a little bit and maybe contrast that to how we think of osteoarthritis in dogs?
Yeah, absolutely. So I wouldn't say that it's always, but it
Mm,
is absolutely a reason for them to get OA, which is very different than the canine patient. So dogs almost always have an underlying reason for that joint to have developed osteoarthritis. So is that osteochondrosis when they were younger, or elbow dysplasia, or hip dysplasia, cruciate disease? You know, there's something actually going on in the joint that then triggers secondary osteoarthritis to form. Our cats can absolutely get that too. So they get cruciate disease, they get patellar luxations, they get hip dysplasia. So we don't want to forget about the fact that there can be an underlying reason for them to get it, but about 50% or so of the time, it may be just primary OA that developed. So that's really what humans get as well. So we'll just
mhm.
get OA. Our dog patients don't just get OA. So if they have OA on a film or on your physical exam, dog, you're going to want to look for a reason. Cat, still want to look for a reason, but not be surprised if you don't find one. So that makes it a little tougher to treat then too, because in our canines, we're like, oh, all right, well, you have this. So oftentimes if we intervene and stabilize the cruciate or treat the hip dysplasia however we can, you know, that can help slow progression. Whereas with a cat, if there is no underlying reason, then we really are stuck treating that symptomatically.
Treating primary OA. Yep.
Yeah.
And I was going to say they
Mm-hmm.
get crazy feline knees and teeth syndrome where
Yep.
they bust
Yep.
their patellas and have retained deciduous teeth because
Yep.
cats are cats.
Yes, they sure do. Yep. So
Are there
and they'll get
particular
genetic
Mhm.
predispositions things to, like, you know, the Scottish folds when they've got instead of heterozygous with their adorable ears, if they're homozygous, you know, they can have horrible like ankylosing osteoarthritis that it can be incredibly debilitating. And so there are those genetic ones that are out there that you know, certain breeds will get, and so that can be tough, but certainly something to bear in mind that there are populations of cats that will get things like that for sure.
When we're thinking about osteoarthritis in cats, are there joints that are most commonly affected?
Yeah, so there's a couple papers that have evaluated that, and they're a little bit, contradictory in what they found. But one, the hip was one of the highest ones versus another paper, the elbow was. So probably those two are the ones that we really want to evaluate, and especially with the elbows, because they often will have severe cartilage changes, but not a ton of radiographic changes, and so there's actually a pretty nice study that looked at that, and unfortunately it was gross necropsy and histology, but the radiographs, unlike a dog, right, we're all used to having that creaky lab come in who can only bend his elbows 20 degrees, and you
Mhm.
feel it and you take the films and you're like, oh, any first year vet student could see that from across the room. Cats can have pretty significant discomfort and changes from their osteoarthritis in their elbows, but not have a ton of osteophytes. And so that makes it a little tricky, especially if it's not a cat that wants to have an awake physical exam where you're like, oh, you're uncomfortable in your elbow, and
Mhm.
then I take a film and I see OA and I'm like, okay, yeah, nailed that. They may have minimal changes, but still have severe joint disease. So,
Reminds me of something one of my professors said years and years ago that's always stuck with me is that animals walk on their legs, not on their X-rays.
yep. Yeah. And that's very true, right? So we always say treat the patient, not the films. So the films are
Mhm.
great, especially if they definitively confirm something. But if you don't see a ton of change and that cat's really struggling and you're like, I trust your physical exam. They're painful in the elbow. You may want to do some trial OA treatment and see if that's going to help out.
Plums is putting the support you need in one place. Building on 30 years of providing accurate drug information to veterinarians, Plums is branching out to give you day-to-day, patient-to-patient support. With faster search, intuitive navigation, and unprecedented new tools like the drug interaction checker, you'll be prepared for whatever practice brings. Plan on maximum prescribing support at plums.com. So another thing that you stress in the article is that osteoarthritis in cats is really this chronic condition. And so we are going to be managing this, but not curing it. I'd love to talk a little bit about the kitty in this case. His name was Max,
Yep.
and he was treated. You followed out this case for 2 years with medications. Weight loss was a big thing, acupuncture, and then your rehabilitation sessions. So with kitties, I'm very comfortable with massage and range of motion exercises in dogs, especially after things like cruciate surgery. What are some of these techniques that you can use in kitties?
Yeah. So in this regard, they are a little bit like small dogs. So, and Max, I'm happy to report, is still with us and kicking. I actually just saw him probably about a month ago or so. So he's still living his best life. So we've seen him for many years. But yeah, weight management is one of the biggest things, and I think you dive into the literature anywhere, human, canine, not as much feline, but certainly there's some weight management makes a huge difference symptomatically for these guys. And so, I think we see obesity in our feline population, unfortunately, quite frequently. And so, on a good news is that's something we can work on, right? And we can help. And it does make a big difference, especially knowing that unlike dogs, we don't have as many really good pharmacological interventions for arthritis, right? So I'm sure we'll touch on that. But doing the physical therapy to help with the range of motion, I think that's huge because a lot of these guys are, there are older muscle wasted kitties, right? And is that because of OA? Do they have concurrent renal disease? Those are all things to think about and look into. But we know that mobility starts with range of motion and strength of muscles. And so if we can do some things to help out with that, then that can often make a big difference in their mobility and comfort at home.
Yeah, I find that's a really difficult thing too, especially when explaining to clients when your kitty has, muscle atrophy or muscle wasting, but then is still overweight, still has a body condition score
Yeah,
that's high. And so you're trying to explain, we need to get the muscle back up, but we still need to get this weight off because they're too heavy.
yeah, yeah. And it's tough, right? Especially if you have multiple cats and you want to free feed them, and the struggle is real. I would love to free feed my cats, and then they would weigh 30 pounds because they neither of them have self-control.
At all.
So so here we
Yeah,
are. Yeah, yeah. But
I
I
think
mean, it's tough. Yeah, it's absolutely not an easy thing to convince an owner, especially,
mhm.
we're all busy. And if you got kids and they're throwing stuff on the floor, it's it's a challenge for sure.
Luckily, I'm through that stage. My kids are old enough that
Yeah,
they're finally not throwing things on the floor anymore.
yeah. Well, then they'll become the age of mine, and then they purposely just feed them.
One of the things, that Max I'm so happy to hear Max is still with us, that's awesome. One of the things that, you talked about Max's rehab included was treadmill sessions, and
Yeah.
actually, I mean, this surprised me with a cat, like, so how commonly do you get cats to walk on an underwater treadmill? Is this really patient dependent? Is Max just like a cool cat or
He was a sassy pants to begin with. So, but that said, I actually can't think of a cat that maybe like one where we really just were like abort mission. So they may not love it, and they may give you the grumpy face when you're doing it, but
Mhm.
for the most part, we can acclimate them pretty well. Many of them are food motivated, so that's very helpful. But we just start the water super low. So it's, just their feet. We don't just throw them in there, up to the elbow right away. And so we try to keep it a nice, warm, comfortable temperature. But it takes a little bit of effort. But for the most part, if you take your time and are able to commit to the process, in general, we've been quite happy with getting them in there, and it does help a ton. So if you're able to do it and you have the patience and the willingness, and wear long sleeves, no, they're usually you can get them to do it eventually.
Get yourself some leather gloves that go all the
Yeah,
way up to the
yeah.
elbow.
Steal some things from radiology and have at it.
So you had, we touched a little bit, and we're going to definitely dive into more pharmacological, treatments for osteoarthritis. Certainly, NSAIDs. We know NSAIDs work in cats. They alleviate pain, they alleviate inflammation. But I know there's a lot of hesitation to use these medications, especially long term, because of the fact that there are some potential pretty serious adverse effects. There's black box warnings out there. Clients are getting information off the internet. So, just could you, like, in general, what role do you think NSAIDs play when we're managing osteoarthritis pain in cats?
Yeah, I mean, I think that is a massively client
Broad
to
question.
client conversation, right?
Yeah.
Because they are effective, right? I mean,
Mhm.
before it got, black boxed, we know that meloxicam helps cats. It is labeled in other countries. Even Onsior, robenacoxib, is labeled for longer term use in other countries. And so, you know, uh, you have to warn people. I personally put it in writing if they're going to use it off label, but it's that conversation of, yep, we know that there's certainly risks of using it, but if this is what allows comfort and mobility, then maybe that's something we consider. If I use it, and I do, but not without a conversation with the client and with the right client. then I try to use as low a dose as possible, go every other day or every third day. But, it, it's tough because they are effective. And so, we just have to be upfront that it's off label use. So,
Mhm. And then, like you said, they are labeled for some, longer use, longer duration, or for other indications in other countries. So it's just one of the things that we see sometimes with our international audience that
mhm.
they seem to think we might be a little bit too cautious using those
Yeah,
medications here.
yeah, yeah. I will use them off label for
Good,
the for the
good.
for the right patient.
Mhm.
So certainly there are, I think, times where it's the best choice.
There are other things we can turn to. So gabapentin, tramadol. My
Mhm.
understanding is tramadol is actually pretty effective in cats. I know there is
Yeah.
some question about its bioavailability in dogs and whether or
Mhm.
not, it truly acts as an opioid in dogs. Amantadine is another one that you mentioned in the article.
Mhm.
Do you have like a specific order that you try them in? Do you prefer one over the other, or is this really tailored to each individual patient?
Yeah, great question. So it is for me very patient to patient and what they're going to use. So I would say for tramadol, the pharmacologic studies would indicate that about 50% of cats will actually metabolize that into the M1 metabolite, which is the effective mu-like opiate receptor antagonist. And so I do try it. That said, there are cats that will not take a liquid, right? And so, gabapentin, you're almost always compounding if you need to, just because of size wise. If they're able to tolerate sprinkling a bit of a capsule, sometimes that's helpful, and it's, one versus the other. And some owners are like, yeah, I can only do a liquid, and then you're compounding something. Um, I think that, gabapentin and tramadol, we just have to remember that there's not a ton of evidence for either of them, right? And so it is a little bit more trial and error. Um, Gabapentin, we don't want to fool ourselves that, oh, like, they're nice and happy. Well, is that just the sedative effect, or is it actually the pain relieving effect, right? So we write about it as an option, but we actually don't have any great studies, canine or feline, for its efficacy for pain management in an osteoarthritis model, right? And so we use it, but we just have to be cautious and honest with ourselves. If we're not seeing a change, maybe this cat needs something different, and then I'm going to try something else. And that's where using some of the validated owner questionnaires for, what is their number and where are they at, and are we actually objectively making a difference, and those things ask about at home activity, and so it can be a more objective way to actually assess, okay, yes, now you're doing this much more frequently again, and so maybe this really is actually helping. Because much like human medicine, right, we have pretty high placebo effect in our
Mhm.
patients, and so for me, for those long-term chronic ones, using those validated questionnaires can really help us say, okay, yeah, like, be honest, it's not
Right.
working.
This is
Time to try
Yep.
something else. Yeah.
So, how long do you usually give them on a particular medication? Are you usually, giving a couple weeks before we say this really isn't working, let's try something different or let's
Yeah,
add something
I
in?
usually like at least a month just to
At
see,
least a month.
and
Yeah.
I try not to do too many things at once. Otherwise, it's really hard to know, okay, which one is it actually making the biggest difference? So if I'm going to make a major change, I try to let that kind of settle in for a while and actually see how much of a difference it's making.
And then one of the things that I kind of want to end on is obviously the FDA recently approved a new medication. It's
Yep.
actually approved for osteoarthritis pain in cats. It's the feline specific anti-nerve growth factor, or frunevetmab.
Yep.
So,
Rolls
um,
right off the tongue.
doesn't it? So I know was waiting for a long time for this to come out, this treatment to come out. And now that it's available, I would love to hear if you have experiences with it
Yeah.
and how you're incorporating it into, a multimodal approach for osteoarthritis pain in kitties.
Yeah, so we do have it available at our hospital, so we do use it. For me, I think they did some very strong studies in terms of safety and initial efficacy. I think the big question, as with anything when it's new, is how is it going to work long term? And so there's some anecdotal concerns that they're going to build a tolerance to it, and it's going to be effective only for a period of time, and how long that is, we just don't know. So we don't really know, one, is it going to happen, two, how often, and three, how quickly. So those are, I think, the big up in the air questions. So for me, I'm still cautiously using it. I'm not using it in super young cats who still have a long way to go, because I do think we've seen pretty good response to it in the patients that we have used it for. And so kind of, my thinking is, I'm going to save that as a choice for later in
Hmm.
case we do only get it for so long. And if there's other things that I can use now that are going to help, then great. But like, Max got some, so he liked it.
He did. Oh,
So
good.
yeah, so for me, it's my older, more chronic ones, especially if they have concurrent stuff where I'm like, oh, I really can't off-label you an NSAID, and so I really
Hmm.
am limited for choices. Or it's a cat where it's like, you know what, I couldn't pill you every day either. And,
Hmm.
the ease of the once a month injection is super nice for clients. And for some of those cats who you're just like, for whatever reason, I mean, I had a cat who was just a disastrous nightmare to medicate. And for sure, I wish that had been available when he
Yeah.
was alive. And so, whether it's the client situation, I travel a lot, I'm not here, I have little kids, I just like, I can't do it, that those are the ones that we're starting to use it on. And then, we're hopefully going to be able to follow them out and get a better idea of how it goes. But I think it's a great option for us for some of our patients right now.
Yeah, it's really nice to have another tool in, our toolbox for those, because it is something that a lot of people struggle with, Like I said at the top of the episode, I know I could be doing better for my patients, especially with these chronic pain. So,
Yeah. Yeah,
thank you so much.
they're hard. Yeah,
Yeah.
they're hard cases. And I know we didn't
Yeah.
touch on it a lot, but I also do think that if you work with a rehab place, not only just for the treadmill and the exercises, but some of the other modalities, particularly acupuncture for
Mhm.
musculoskeletal stuff, I think that can really help out our feline guys. And people are like, oh, they won't let you do it. I'm like, beg to differ. Cat,
Yeah.
once you get them in there, like, they love it. They just sit there, they just take a little nap, like. So I think that's another option that's well worth it if that's available at your practice or in your area.
Sure. What about laser? What about like a therapy laser?
Yeah, I think for some things that's great. I think it helps the most in acute inflammatory phases. So for the more kind of chronic set things, it's probably not as
Mhm.
good. But for kind of the acute on chronic stuff, I think that can play a really nice role too. So
So, lots of stuff out there, lots of stuff on the horizon. It's really exciting. So,
yeah, yep,
so again, I really appreciate you sitting down and talking us through this. Max's case was really interesting, and I learned a lot about, what we can do for these kitties. Before I let you go, I do have one last thing. We play a little game at the end of our podcasts with our guests. It's really easy. It's just a few would you rather questions. There's no right or wrong answer. It's just for fun. So,
no
do you
no
want to play with
pressure.
me? No,
Let's
no
do
pressure at all.
it.
All right. First question. Would you rather perform surgery on your own pet, or would you rather have a trusted colleague do it?
Oh, trusted colleague. I can't do my own.
Some people, yep. Some people don't want to do their own. Would you rather practice without a vessel sealing device or without a CO2 laser?
Oh, without a CO2 laser. Yeah, hands down.
Everybody loves their ligature.
Oh, can't live without it.
Would you rather invent a new surgical procedure or would you rather discover a new class of analgesic drugs?
Oh, as a surgeon, I want to go with surgery, but I feel like more impactful to discover a new analgesic. So I'm going to go
It's a
with
hard
that.
choice, isn't it?
Yeah,
Yeah.
tough
All
choice.
right.
Yeah.
Okay. If you had to go in and retrieve one, would you rather go get an ET tube that had been aspirated or a urinary catheter that doubled over and was stuck in the urethra?
Oh, ET tube. Done
Go
both.
get the ET tube.
That urinary one is no fun.
I can imagine neither of them are fun.
Yeah,
So I'm
yeah.
going to
Oh,
send
the
both of them
ET
to
tube's
you.
not bad. You just like get in there with the graspers, and it's usually quite gratifying. Thankfully,
Okay.
not frequent.
Yep. Last question, and this one is incredibly important because, as I said, you went to ISU.
Yeah.
So, who makes the better sundae? Hickory Park in Ames or Jenny's Splendid Ice Cream in Columbus?
Oh, Hickory Park, hands down.
Right.
Yeah,
It's so true.
yeah. Sorry,
I said
Ohio.
there, yep, I said there weren't right or wrong answers, but there
Yeah,
was
but
definitely a
there's
right
one.
answer to
There's
that.
one. Yeah. Now I want to go back and get one.
Well, it'll be there. It's going to be there forever because it's a local favorite. So anybody that's in Ames, stop in Hickory Park. And thank you so much for joining us again today. This was great.
Yeah, my pleasure to be here.
Thank you for listening to today's episode. If you enjoyed our episode, you can find us wherever you listen to your favorite podcasts, including a video version now available on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts or drop us a line at podcasts@briefmedia.com. Clinicians Brief the Podcast is a Brief Media production, produced by Alexis, Ussery, and hosted by Dr. Alyssa Watson.